The information shared on this podcast is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking care because of something you heard on this podcast. The views and opinions expressed by guests or hosts are their own and do not necessarily reflect the official policy or position of any affiliated organizations. Reliance on any information provided by this podcast is solely at your own risk. Welcome to the Healthy Image Podcast. I'm your host, Veronica Gregola.
And I'm Luz Chaides.
And today we have with us Holly Adamous. She is a board-certified family nurse practitioner with over 7 years of experience. She specializes in injectables and laser treatments. Her work has been viewed by thousands, and she's known for making aesthetics approachable, educational, and empowering. And her mission is to help people feel confident and beautiful on their own terms. Welcome, Holly.
Hi, thanks for having me.
Welcome, Holly. So thank you so much for being here. We want to start off with what inspired you to get into aesthetics and injectables, and was there a moment when you knew this was your calling?
The story is actually kind of interesting. I want to have this really cute story that it was my passion, but it really wasn't at first. So when I graduated nursing school, I actually wanted to go into the hospital and I wanted to eventually do family practice. But one day I was like, I need a job. And I'm like, I'll take any job I can find. And then I found a job in aesthetics. And I just fell in love with it from there. So I always thought it would be temporary, but the more involved I got, the more I learned, the more I was like, this is actually my calling. And I think it was just chance. Like it fell into my lap and it became my thing. And I've been doing it ever since. So,
oh, wow, that's amazing.
Yeah.
And how do you define beauty or wellness in your own words?
I mean, beauty and wellness to me is really how a person feels. Beauty really is in the eyes of the beholder. Like I know that in aesthetics there is a certain beauty standard that we learn in like psychology, but to me beauty is how somebody feels. If you feel good about yourself, if you feel confident, that is beauty. It's feeling good, and that helps with wellness because it's all about the mental health, I think.
Absolutely. And that goes into the next question. And it does often overlap with confidence and mental health.
Yeah.
And how do you tie the connection between the two with your patients?
So for me, my approach is really helping someone feel confident. At the end of the day, we're human. And our appearance matters. Like as much as someone wants to say appearance shouldn't matter, it's about your accomplishments and your personality. We look in the mirror, we look at ourselves, we find things that we don't like. And when a patient comes to me and says like, this is bothering me, this is on my face or on my body, and it just, I don't feel good when I look at it, my job is to help them feel good. Because if you see something in the mirror that you don't like, sometimes that weighs down on your mental health. Like you don't feel so confident, you don't feel so good, and then it's just like a snowball effect on your mood. So it's more of like a mood booster, or like just helping the mental health. Like I just want the person to feel good.
Absolutely.
Yeah.
I like that.
Yeah, it's just like when you are getting ready in the morning, and I can totally relate to this, if you think about it, even without cosmetic procedures, and if you look in the mirror, when you just wake up, we brush our hair, we put makeup on, we brush our teeth, like we do all of these things to better our appearance just to leave the house, because if we didn't, it would be scary.
Yeah. I know. Trust me.
Yeah, no one wants to see that, you know.
Yeah, so it matters. Like as much as we don't care, we care a little bit, you know? And I think it does affect the mental health.
Yeah.
So it helps to feel good. And my job is not to create perfection. I don't believe in perfection. I don't think there's such thing as perfection. My job is to just help my patient feel better about whatever it is that is weighing down on them.
That's wonderful. Yeah. That's awesome.
Yeah. I know a lot of people think of injectables as just cosmetic procedures. How would they fit into a broader health and wellness routine, or just like your overall, not necessarily for a cosmetic reason, but just a health reason?
So in aesthetics, even aside from Well, for example, we do a lot of Botox or neuromodulators for patients who have TMJ, like they're clenching their teeth a lot. So we do, aesthetics kind of does overlap with um, some therapeutic outcomes. Like we get people who come in and say, I get really bad headaches, like I'm clenching my teeth a lot. And that's when I'll place Botox in their masseters, and it gives them so much relief from all the tension. Aside from injectables, and I know this actually is perfect for October because it's Breast Cancer Awareness Month. There are a lot of lasers and a lot of treatments like microneedling that help breast scars. So post surgical breast scars. I
Wow.
actually just treated someone recently, a couple weeks ago, who had surgery for breast cancer, and she had these really bad scars, and she came in and we microneedled it and we did some laser treatments, and it really helps reduce the appearance of the scars because, again, she doesn't like them. It's something that bothers her, and we could help minimize that and help make her feel better about the appearance of the scars. So
Yeah. And that's something that typically she would only see anyways.
yeah,
That's, so
yeah,
it does go to show it's
yeah,
for, you're not doing it for everybody else. You're
yeah,
doing it for what makes you feel good.
yeah. I mean, maybe the scars remind her of something bad, like a bad experience,
Yeah.
and
Yeah.
getting rid of those, or minimizing the appearance was helpful in helping her move on or forget. But
Yeah.
I do think that aesthetic procedures really do help in a broader category. Again, toxins are really helpful in like TMJ, in pain. I get a lot of jaw pain. And if I don't put that Botox in my jaw muscle every few months, then I'm always having headaches. People actually do it in the back of their neck. But it does go into a broader category. I think it really does help people um, outside of just like the appearance of their face.
Yeah. And I know it's injectables, Botox, that is a very hot topic right now. I know
Yeah.
there's a lot of people who are curious about it or have thought about it but don't know where to look.
Mm.
Um, if somebody was going to get a cosmetic procedure done just for the look, like something on
Sure.
your face that you don't
Sure.
love,
Yeah.
that you want to change,
Yeah.
how do you balance doing what is just needed and not letting them overdo something? Because I know that's probably one of people's fears, is going in and coming out
Yep.
that you hear all these horror stories and
Yeah.
that's what scares people. How do you balance that to make sure that it's the right amount of work?
Education is super important. A lot of education. So I do get a lot of patients who will come in and they're so afraid of, the aesthetic procedure, and they're like, I don't want to look fake. I'm terrified. And educating the patient is really important. Like, hey, this is how Botox works. This is what happens when I place it in the muscle. It's going to relax your muscle, and then you won't make that expression that's like creating those creases in your face. So, educating them is important. And then it's also important to be that practitioner that is looking out for the patient. If I have a patient who asks me, what do I need if you look at my face? Like, I just feel like I want to start an aesthetic procedure, but I don't know where to place the Botox. I just want to look refreshed. I will guide them into treating areas that are necessary. I am the type of practitioner that'll say, you know what, you don't need it here. Like, in this area of your face, I don't think you need it yet. Let's focus on this area. So it is a lot about honesty, knowing what your patient's outcomes are, or what they want, like their expectations, a lot of education, and just not overdoing it. So it's a lot of um, conversation with the patient. You really have to know, like, what are you looking for, and not giving them more than what they need, or just doing what you think is what they're wanting in that outcome, if that makes sense.
Yeah.
Yeah.
And how do you notice, is there some sort of lifestyle habits that can either make procedures last longer or, make them last or look better?
I know what can make it not last and not look better. um, Definitely like smoking, drinking, sun exposure without SPF. Like, I've seen a handful of people that will spend a lot of money and get a lot of aesthetic procedures, but they're out there smoking like a pack of cigarettes a day, or they're drinking every night, or they're vaping. I see a lot of vaping.
Oh,
And
wow.
this is all oxidative stress. This is all, you know, toxins at the end of the day that are undoing what we're doing. So if I'm, putting filler in the face and I'm doing your Botox and it looks great, but you're going home and you're vaping or you're smoking or, you're baking in the sun without SPF, all of that damage to the skin, it's gonna undo everything. It's not that it's gonna undo the filler or the Botox, but it's gonna damage your skin and your outcome won't look as good. So I think where I'm going with this is doing the opposite of that. So
Right.
drinking a lot of water, protecting your face from the sun, eating healthy. You have to have a healthy lifestyle to house the treatments, if that makes sense.
Oh,
Yeah.
absolutely, absolutely. And I know that there are times when you do Botox, you give them like the post-treatment procedures,
Yeah.
and one is, I believe, is don't exercise for
Yeah.
like 24 hours.
Yeah.
Can you explain a little bit more about the post-procedures or post-treatment? And then
Yeah.
also, I know there's, so a two-part question, and I know that there are different kinds of Botox, if you will,
Yeah.
or neuromodulators. Can
Mhm.
you explain that
Mhm.
too?
So, one of the more important post care instructions that we have is that you can't work out for about 24 hours after the treatment. So, when we place a neurotoxin or a neuromodulator in a muscle, it's very precise where we're placing it, especially when it's like in the face. There's a lot of precision in exactly where we place it. And for the first day, that neurotoxin is it's kind of like movable because that liquid hasn't fully absorbed. It's kind of still sitting in that muscle and it can move. So when we don't want people to work out, we don't want their body temperature to go up. We don't want them, to start sweating because that heat can dilate some vessels. It could also move the product around. We don't want that product to go into the wrong area and like leak into an eyelid and someone has a droopy eye. So it's very important for the first day for people to take it easy. You don't want to move around too much. You don't want to raise your body temperature, just so that where the toxin is placed, it kind of stays in place. And for the second part, neuromodulator, that's the term for like all of them. I know everyone knows what Botox is because they've been around the longest and they kind of are the most famous one, but Botox is a brand name.
So neuromodulators is what Botox is, and all of these.
Exactly.
Those are brands.
Exactly.
Gotcha.
Exactly. So they really are, they fall under the category of a neuromodulator. We have Botox, we have Xeomin, we have Dysport, and now there's Jeuveau, Daxify, Latibo. There's so many on the market. And they all are a little different, like molecularly. Some are like made up a little differently just because of I guess like licensing reasons, right? They have to change it up before they can create a new product. But essentially, they do the same thing. They go in the muscle and they relax that muscle so that that muscle can't flex as strong and you don't make the lines or the wrinkles that are bothering you or coming into the skin. Yeah.
Perfect, perfect.
Okay. What advice would you give to somebody who is wanting to age gracefully, but still, with the help of neuromodulators, injectables? Where do injectables fit into that journey?
I think doesn't have to aging gracefully doesn't mean that you don't have any aesthetic procedures. You can age gracefully, but you have an injector, you have a relationship with an injector who knows that you are trying to quote unquote age gracefully, and they know how much to give you so that, you still look like you're aging, but not so how to not severely, but I don't know
Not
the
as
term.
quickly. Not as
Yeah,
quickly.
yeah. So it
Yeah.
fits in it. It's fine. There are people who come in for Botox and they're like, I like my crow's feet, or like I like the wrinkles around my eyes. So just put a little bit. Like I still want them there, but not as strong. And I think that is, that plays a role in someone who still wants to age gracefully. They can still do aesthetic procedures.
Wow. And speaking of aging gracefully,
Yeah.
I know that there's also something, a term out there called biostimulatory fillers,
Yes.
and where I read a little bit how they can stimulate your own collagen, and especially as we're aging and we're entering new decades of our lives, we're
Yeah.
losing collagen.
Yeah.
Can you talk more about biostimulatory
Yeah.
fillers and help
Yeah.
our guests and audience know more
Yeah.
about them and what they are?
Sure. I'm a huge fan of biostimulators. Biostimulators are actually a liquid, so they're not like an actual dermal filler. It's not a gel, it's not anything that's like filling a gap, but they're liquids that have particles like PLLA. I won't get too scientific, but basically they have molecules in them that when they're placed in the tissue or the skin, these molecules start to trigger your body into creating collagen and elastin and just like tightening up and thickening up. Like your skin gets tighter, thicker. And these biostimulators are a good option for people who feel like, they have all over volume loss and they kind of don't know where to start and they don't want to go the filler route. And for example, we have one that's called Sculptra that's very popular. And a lot of people talk about Sculptra as fertilizer for the face. So it's kind of like I'm sprinkling fertilizer in your skin, and all these little PLLA molecules are just like going in there and they're triggering all this collagen production. And so over time, your own body is tightening up, the skin's getting thicker, the quality is getting better. And that's why I love biostimulators. I think it's a really, really great part of aesthetics, especially for people who want to go that route of like slow and steady. I'm okay with doing things that like take time for my results.
That's
Yeah.
wonderful. And I heard there's also Radiesse and
Yeah.
Easy Gel, even
Yeah.
Renuva.
Yeah.
I was reading up
Yeah.
on it
Yeah.
before our,
Yeah.
our session
Yeah.
today, and I
Yeah.
just thought it was so exciting
Yeah.
that there's this new trend out there
Yeah.
of something that's a little bit more natural.
Yeah, we do. I'm a huge fan of hyperdilute radius, which is also a biostimulator. That one, the particles are a little different than the Sculptra. It's more calcium based, but it essentially does similar. So it stimulates collagen, elastin, blood vessels, all the good stuff we need to like thicken the skin. There is one called Renuva. That one actually helps stimulate adipose, which is fat tissue or fat cells. And that's really helpful for people who have lost a lot of weight and they lost a lot of volume in their face and they want their own fat to be stimulated. So there is a lot out there. And Easy Gel, like you said, that's when we draw the blood and we just do this long process of spinning the blood and turning the plasma into a thick gel, and we use that for like rejuvenating the under eye. These are all great options for people who want to go slow and steady. But I'm still a filler girl. Like I love my filler, I love my Botox. I think doing all of them together is like the perfect marriage, not one or the other. I do think that both are great.
Wonderful, wonderful.
What is the most requested, I don't want to say procedure, like if a person comes to you, what is the most common request for them to fix or change?
I think the number one phrase I hear is, I feel like I look tired. Like, I look tired. And a lot of people are like, can you help me not look so tired? And I'm like, oh, we're all tired.
Yeah, I'm like, wait, was that me?
Yeah, exactly. I know. It's like we're all working. We all look tired. And usually when I hear that, that's when I kind of like dive deeper. I'm like, okay, you look tired. I can help. But what procedures have you done and what haven't you done before? And usually, if they're new, I start with Botox because a lot of times looking tired, maybe your eyes just feel a little heavy, and it's very easy to just like lift up the eyebrows a little bit. And I usually do a little bit of neurotoxin around the eyes or like between the eyebrows. I do feel like a lot of people come in for the crease between their eyebrows, which we call the 11s or the frown lines.
It's because we're so worried all the time.
Yeah,
Yes,
yeah,
exactly.
exactly.
Yeah.
Because we're always worried or we're always staring at the screen. So people are like, I'm on the computer all day and I'm noticing that like I'm always like angry, and or when I'm driving and the sun's at my face, I'm always frowning. I can't frown because of
She doesn't have 11s.
well, it's a lot of Botox, but so I feel like that's actually the number one is that frown, and that always gets me excited. I'm like, oh, welcome.
Yes, yes.
We're
Yeah.
gonna fix this.
Yes, I can't do an angry face either.
Yeah,
so.
exactly.
Hint, hint.
Yeah.
And I know that, I mean, I don't know much about this topic, so I might sound,
No, it's
but
fine. Yeah.
because I just noticed for me personally, like I
Yeah.
look at pictures of myself from
Yeah.
10 years ago and I'm like, how do I do that again? And then so I'll like recreate my makeup and like do my hair and I'm like, okay, that does not look the same.
Yeah.
It's like, you know, your face, you're aging, your gravity is happening. So it's like you kind
Yeah.
of notice just like your face
100%.
like hanging almost a little bit.
100%.
So what would be, I know like filler could help that, but like
yeah.
a facelift, but what's
Yeah.
the difference between those
Whatever.
and how
Yeah.
for somebody who is just starting to notice like that
Yeah.
the face is starting to,
Yeah.
you know, you're again, gravity's happening.
Yeah.
What would be your recommended procedure for that? Like when do you go to from filler to you need a facelift?
I think first things first. I like to tell people when they pull up pictures from 10 years ago, I can't take you back 10 years.
I wish.
I'm
that
sorry.
would be amazing.
You know, because I get a lot of that. I get a lot of photos, and they're like, "This was me in my 20s," like, or like, you know, "This was me when I last had cheek filler." I was like, "Well, how long ago?" And they're like, 10 years ago. Because we lose a lot of bone. So, like every year, we lose collagen, we lose fat, we lose bone. Our muscles start to separate. It's very depressing, but we're losing everything.
Oh, goodness.
So, you know, it's hard to recreate that, but I always say least invasive to most invasive, right? So if someone's starting out in aesthetics and their laxity, quote unquote, is very mild, injectables. You know, let me replenish some of that lost volume in your cheeks. Let me start with a couple syringes of filler. Let me throw in some biostimulators if you feel like, you know, you're getting a little lax down by your mouth. And that usually does it. It helps. But you know, sometimes there are patients who will come and maybe in their 70s or 60s or even 50s, and they've been baking in the sun for like 30 years and they've never had an aesthetics procedure before, and they want to look super, super, super young, you know, and they have like inches of skin that I could tug on. That's when I say, like, listen, I can help you today, but for what you're looking for, I would say, you know, why don't you look into surgical options? Because I actually feel bad for people who spend so much money on injectables so often, and I just think like you could put that money towards a facelift. Like, I don't want to take your money every 3 months. Like, I don't want to take thousands from you every few months when that would have added up to the surgical facelift. So it just depends on like the patient's age really, and like how well they've taken care of themselves, and like what their expectations are.
Okay. How has social media changed the way people think about aesthetic treatments? Is it for better or for worse?
I don't know.
Oh, that's a good one.
You know, I love social media because it really like it helps in education. It helps with exposure, right? It helps like if a patient wants to see my work, they can look it up on social media. If I want to educate people, I can post it on social media. But I think it could also be damaging, especially for the younger generation. I feel like we live in a world now where what we see is mostly on social media. And I see a lot of photos online where I'm like, this is face tuned. Like, we're all guilty of it. Like, you know, this is filtered, this is airbrushed. And I feel like a lot of people are desensitized to that. Like, they don't pick it up anymore, and they think this is what the beauty standard is. And I think it's really damaging because I'm getting people walking in through the door showing me inspiration photos, and I'm like, this is not humanly possible. So in that sense, I do think social media is damaging to the aesthetic industry, because I feel like it's the cause for a lot of unrealistic expectations. Um, and there is also a lot of like fear mongering on social media. There are people who are like, I don't know if you've seen the clip online where there's this one woman who goes on, she says like Botox is damaging your brain, or like she
Oh.
said something about, I forgot the clip, but she's on there saying like Botox damages like a certain part of your brain, like where your emotions or your um that's responsible for like your decision making, and people believe it.
Oh my
And she
goodness.
had no credentials. She wasn't a medical professional, anything. And then it spread like wildfire, and everyone's like, people are believing it. So it's good and bad. It's a double-edged sword. Is that what it's called? A
Yeah,
double-edged
yeah.
sword?
Yes,
Yeah.
absolutely.
What would you say? I know there's a lot of, you kind of touched on it a little bit. People have these misconceptions, these myths kind of go around. What's like a common myth that you hear a lot? Whether it's about filler or is there a common myth that you hear people?
Yeah, I get a lot of. I think we're in the middle of this anti-filler movement right now, which I think is ridiculous because I love filler. But I do get a lot of people who are afraid, and they're like, I heard it falls, and like if you put it in my cheeks, it's gonna fall into my jawline. That's a myth. Like, when a trained professional is putting that filler in your face, they know what plane to put it in, they know what depth to put it in. It's so densely packed in your tissue. It's not falling. Can filler move a little bit? Yeah, it can shift here and there because we have muscle flexion in our face. But I think what happens is that people age and they see like their jowls and they think it's the filler from like 5 years ago. It's like, no, that's just your skin. So that's a huge myth, is that people are afraid of filler and they're like, I heard it falls. It's not falling. It's it's
Yeah.
there.
Yeah, it's there. And
Yeah.
I think it's also how you said earlier that it is more of a combination of doing, filler and doing more of an approach that balances the face with
Yeah.
filler, neuromodulator,
Yeah.
and perhaps a biostimulatory filler,
Yeah.
and maybe other types of procedures that you use depending on the goals that the patient wants.
Yeah. It's always a combo, and it's not like a one size fits all or one appointment fits all. Sometimes someone needs a plan. They need a few sessions, a few appointments to reach their expected outcomes. But it's all in a combination of multiple things that you mentioned, for sure. And again, lifestyle. Lifestyle is really important. I'm all about like taking your vitamins, eating healthy, protecting yourself from the sun, drinking a lot of water. I don't even I barely drink alcohol anymore. Well, mostly because it makes me feel sick. But like, even if I'm having a sip of drink, sometimes I'm like, maybe not. But that's because of my vanity. I was like, I'm a little vain. I'm not gonna lie. Yeah.
So since injectables and cosmetic procedures are pretty popular right now,
Yeah.
how would you suggest somebody who's new looking for somebody, how do they find somebody reliable and not just go to anybody that, is having a deal?
Yeah, that's a good question, because there's a ton of us out there. And I don't even want to say go on Instagram, because there are people who have bought their followers, or like there are people who are really famous online, but they might not be so great. I would say word of mouth is great. Honestly, I always like to talk to someone, like when I'm looking for, let's say, a new lash tech or a new nail person. I ask around. I ask people in my circle, hey, have you worked with this person personally? How did you like their work? How was their personality? Because that even matters too. And then from there, I'll be like, okay, let me look up their work. And then I kind of go from there. Maybe I can find some reviews on them. But back in the day, when I would just look them up on Instagram, it's like, oh, well, this person has 3 million followers. They must be good. But that's usually not the case anymore. So I would say ask around, ask people in your circle, ask people you know if they've gotten a treatment done and who they recommend.
Yes, and if I can add to that, if they're in the Los Angeles area, they can go to you
Yeah.
because you're amazing.
Thank you.
Yes.
Thank you.
Yeah. And to that point, I think we'll wrap this up here. But
Yeah.
Holly, where could people find you?
They can find me on Instagram. I do have an Instagram page, and no, I don't have millions or thousands of followers. It's very slim. But my Instagram handle is at HollyFNP, and I practice out of Los Angeles, more towards Beverly Hills. I have a couple practices I rotate through, so they can find me on Instagram. There's links there to book and have consultations, and I could talk about this stuff for hours. So I'm actually sad. I'm like, oh, it's over.
Yeah, and we'll be sure to put your information on
Sure,
the
yeah.
YouTube link
Yeah,
or on
yeah.
Spotify. We'll make sure that that's accessible to our listeners.
Great.
Yeah.
That'd be awesome.
This was really good. I feel like from somebody who knew very, very little,
Yeah.
I could keep talking too. So
Yeah. Hey, I'd love to come
Yeah.
back and talk more. We can talk lasers and radio
Absolutely.
frequency and
Yes.
skin. I love skin too, so we can start.
And
we can-
skincare, skin
yeah.
products, that's
Oh,
huge.
So
Yeah.
into that stuff. So
yeah, we'll definitely have you back. Thank
Yeah,
you
of
for
course.
joining us.
Of course. Thanks for having me.
Thank you for listening to the Healthy Image podcast. Please make sure to like and subscribe, share with a friend who might find this helpful. And as always, stay engaged, stay curious, and stay healthy. Bye, everyone.
Bye.